What does a cystogram analysis reveal? Imagine peering inside the bladder without surgery, just using special imaging techniques. That's what a cystogram does. It's a diagnostic test that helps doctors see the shape and function of your bladder in detail. This test uses a contrast dye, usually iodine-based, which is inserted into the bladder through a small catheter. As the bladder fills with the dye, X-ray images are taken to capture the bladder's structure. Sometimes, images are also taken as the bladder empties, giving a complete picture of how it works during urination. A cystogram reveals several important details about your bladder. It shows the size and shape of the bladder, helping doctors identify abnormalities like a bladder that is too large, too small, or oddly shaped. It can also detect structural issues such as tears, ruptures, or areas where the bladder wall might be weakened. This is especially useful if there has been recent trauma or surgery. The images can also identify blockages or obstructions along the urinary tract, such as narrow areas called strictures, which can make urination difficult or uncomfortable. One of the key reasons doctors order a cystogram is to check for vesicoureteral reflux. This is when urine flows backward from the bladder into the tubes that connect to the kidneys. Reflux can cause infections or damage to the kidneys over time. The cystogram can show if reflux occurs only when the bladder is filling, only during urination, or all the time. The severity of reflux can be graded from mild to severe, guiding treatment decisions. The test is also valuable for detecting leaks or ruptures in the bladder wall. For example, if there has been recent surgery or trauma, a cystogram can confirm whether the bladder is healing properly or if there are leaks at surgical sites. It can also identify other complications, such as abnormal fluid collections near the bladder. While a cystogram is not a primary tool for screening for bladder cancer, it provides important structural information that helps in overall bladder health assessment. It can help rule out structural problems that might complicate cancer diagnosis or treatment. For patients with known bladder issues, the cystogram offers a baseline view of bladder anatomy and function, which can be useful for ongoing monitoring. Results from a cystogram are usually available within 1 to 2 days. If reflux is detected, radiologists assign a severity grade to help determine the best course of action. In emergency cases, results may be available sooner. Advanced imaging techniques can also measure the volume of leakage if needed, which can influence decisions like when to remove a catheter after surgery. In summary, a cystogram is a valuable diagnostic tool that provides a clear window into the bladder's structure and function. It helps identify abnormalities that may need treatment and offers important insights for managing bladder health. If you are scheduled for a cystogram or have concerns about your bladder, always consult with your healthcare provider to understand what the results mean for your specific situation. Remember, each person's condition is unique, and your doctor can provide personalized advice based on your medical history.